On today's episode of the Nashville Wellness Collective podcast, we have Doctor of Physical Therapy, Abby Daunis, who specializes in orthopedics and pelvic health. I am your host, Unique Cortez. The Nashville Wellness Collective is an online directory and resource with a large list of health and wellness practitioners in the Nashville area that span from Eastern to Western practices and everything in between. So whatever kind of practitioner you are looking for or interested in learning more about, the Nashville Wellness Collective is here to help. Visit us at TheNashvilleWellnessCollective.com and watch or listen to all of our podcast episodes, read our blogs, and more. Whatever part of your health and wellness journey you are on, the Nashville Wellness Collective has you covered from east to west. Go ahead, tap that like button and leave us a rating, as it really helps the channel. If you have any questions, please leave them in the comments. Now, into the world of orthopedics and pelvic health. Without further ado, I give you Dr. Abby Daunis. Welcome to the show.
Thanks.
So I just gave a quick introduction, but did you want to tell us a little bit more about yourself, what got you to this point in your life doing physical therapy, and also what kind of physical therapy you specialize in?
Sure. Yeah. I grew up outside of New Orleans, and then I went to PT school in Dallas, Texas. Growing up, I was always interested in healthcare, and I think I just always loved movement and exercise from when I was a young kid. So, I think by the time I got to college, I was thinking about what I wanted to do as a career. Mm-hmm. And I thought about going to med school, but I didn't like the idea of seeing blood. So,
oh goodness,
I know. So someone told me about physical therapy, and a lot of people become physical therapists because they go through it as a kid, and that actually wasn't me. But I started looking into it, and I liked the idea of conservative treatments and using exercise, and then like, of course, all of these other modalities that we learn about, and using our hands a lot to help people. And help people feel better and get out of pain. And that's what really drew me to become a PT.
You specialize in, because you've also told me that you are a triathlete.
Yes.
And so were you a triathlete first, and then that kind of led you to incorporating that into your physical therapy practice? Or how, okay, let's hear the story behind how that came about, and then you can tell us more on pelvic health.
Yeah, totally. When I was in college, I started running because in high school I was a dancer, and then I went to
that's awesome.
It was really fun. I still have a lovely space in my heart for dance.
Yeah.
So I got to college and I wasn't dancing because I went to a big D1 school, so I started running.
Okay.
I had an interest in running, and I wanted to know more about running and performance, and just how to be a good distance runner.
Mm-hmm.
So I started running. I trained for my first marathon in college.
Nice.
And ran it with a bunch of my friends. It was so much fun.
Congrats.
Thanks. And then that was actually a class that I took in school, in college, about like learning how to train for a marathon and writing like a training plan for a marathon.
Yeah.
It was called like Marathonology 101 or something.
Marathonology.
Okay. It was super fun.
Cool.
The professor was great. She was an exercise physiologist that was at LSU at the time. And then the next year she said, "Hey, who wants to take a triathlon class?" So we all followed her.
Wow.
And we took a class learning about triathlon. And that's how I got started.
That's awesome.
Mm-hmm.
Oh my gosh.
Yeah. And I made some of my best friends.
That is so great. So it coincided with your studies. And so that's so organic.
Yeah, it was really cool. So,
okay.
So that was in undergrad. And then at the time, she was also a mentor of mine. And I went to her and I said, "Should I do exercise physiology?" And she said, "No, I think you should go to PT school." And I said, "Okay, great. I'll do that." So
there you go.
So I went to PT school. And I kept doing endurance sports, running and triathlon, because I loved them. When I was in PT school, actually, I got probably like 10 girls in school to do their first triathlon with me.
Wow.
Mm-hmm.
Oh my gosh.
Yeah.
Influencer.
Yeah.
Okay.
It was so much fun. I just love it. And they all had an interest, and I was like, well, I've done this, so let's go do one. And we did. And then fast forward from there, I graduated from PT school, got a job doing outpatient orthopedics, and chronic pain things.
Okay.
And I always still wanted to kind of like tie back in treating runners and triathletes because I
Yeah.
loved the sport so much.
Yeah.
And I kept doing them as my career went on. So yeah, I just, I started taking some continuing ed courses in like specializing in treating runners specifically.
Okay.
And then, obviously running is part of triathlon. So I started seeing triathletes and runners, and I would kind of like market to that population.
Yeah.
Because I knew a lot about the sports. And then I learned how to rehab injuries like around the sport.
Yeah.
So I would say definitely running and triathlon came into my life first, and then PT school. When I got out of PT school, I worked in kind of a traditional outpatient PT setting.
Okay.
And then when I moved here to Nashville in 2019, a couple years after that, I started out on my own, and I was like, I know who I want to work with, and it's runners and triathletes.
Oh,
So
that's perfect that
yeah.
it's your firsthand experience that
Mhm.
comes first. And
Mhm.
I feel like that really is a huge part because you can
Yeah.
tell people from your own experience, and I'm sure learn and experiment with modalities and therapies too on yourself when you sustain injury or are trying to prevent injury.
Absolutely.
Yeah,
Yeah.
comes in handy.
Yes. Yeah. I've like experienced lots of running injuries and training related pains, things like that.
Yeah, same runner. So
Mhm.
I feel you.
It happens a lot. Lots of hip down treating.
Mhm.
So
Yes, girl.
yeah.
So then what got you into stemming or branching to include pelvic health?
Yes. Yeah. Good question. So when I moved here in 2019, I was very pregnant with my first.
Oh, okay.
Yeah, I was 30 weeks pregnant when I got here. I was calling all the hospitals and midwives and saying, who can take me on as
Yeah.
a patient? So I have had, in the past 5 years, I've had 2 kids, and I had a lot of issues and questions around like, oh, how do I safely go back into exercise in the postpartum period? After my first son was born, I started to run. I tried to run at 6 weeks postpartum, and that felt terrible. So
Oh no.
yeah, and I just like didn't know what I was doing, and I was like, oh, I need to learn more about this. So I started looking into taking some pelvic health courses.
Okay.
So then about a year ago, my sister and I, she's a midwife, and she came with me.
Oh wow.
Yeah.
Okay.
So I know. So
Perfect.
she called me and she was like, let's go take a pelvic floor therapy course together. And so we did. And it was super fun. Yeah.
Oh, that's perfect.
Yeah.
I love how everything's just organically
I know.
happening.
Yeah.
That's just like completely organic. Both things happening for you. You first of all being a triathlete, and then you first of all being a mom, becoming a mom.
Yeah.
Oh my god, that's
Yeah.
beautiful. And then your sister like that.
Yeah.
Businesses are just perfectly matched.
Yeah.
What brings people in to see you as far as like athletes? What are they experiencing when they come a knocking? And then the women too, at what point do they come and seek your help?
Yeah. Good question. So people will come see me at various points depending on what's going on with them. I have a lot of triathletes and runners that they'll usually come see me when they start to develop an ache or pain. I see lots of runners that have foot or knee pain, sometimes back pain, hip pain, you name it. Sometimes my triathletes have shoulder and neck pain. And it's usually, when their training is starting to ramp up. So unlike traditional PT, I get pretty busy in the summer because everyone, that's like peak triathlon season.
Okay.
So everyone's like doing lots of races, or their training is like really peaking in the summer. So yeah, usually when people have an injury or a pain related to training, they'll call me. Sometimes I have people call me and say, hey, I want to prevent injury, or I'm going to try a new sport. Or I have runners that will become triathletes, and they're like, how do I do this safely?
Yeah.
How do I prevent injury? I had knee pain in the past when I was a runner. How do I prevent that? I had someone recently call me who exercises a lot, but is starting to get back into running. Immediately had shin pain, and she said, help. So that's usually when they call me. And then as far as pelvic health, I see lots of women that have given birth recently, and they're in the postpartum period. They want to have their abdomen checked for diastasis recti. They might be having pelvic pain. They may be having urinary incontinence. They want to know, can I safely return to exercise? Can you check my pelvic floor strength? Am I ready to go run, jump, lift again, or Pilates, yoga, whatever it is that they want to do. So that's usually who I'm seeing in pelvic health world. Sometimes I'll see patients that are pregnant and they're having some pelvic pain,
Okay.
or orthopedic pain that they want addressed.
If they don't address pelvic floor issues, so if they are postpartum and then they're feeling some kind of just irritation, what could happen? What could be the outcome if they don't catch that, if they don't treat it? Yeah, I honestly don't know. So I'd like to know, like, from the audience, I'm sure would like to know what happens.
Yeah. Depends on the issue, but let's see. I'm trying to think of a really common one. So urinary incontinence is very common postpartum and intrapartum, or during pregnancy. Postpartum, if someone has a vaginal birth, a vaginal delivery, it's their pelvic floor is going to be pretty weak. So it's just hard for those muscles to control their bladder again and their urethra.
Oh, wow.
Yeah, so lots of leakage with pressure changes. And when I say pressure changes, that means like intra-abdominal pressure. So like sneezing, coughing.
Oh, goodness.
Yeah.
Oh,
yeah.
Anything just slip.
Yep. Yeah.
Ooh,
I know.
Okay.
So, yeah. So it can make your incontinence worse.
Yeah.
A lot of women try to go back into like an exercise class and they'll like experience some urine leakage, and no one wants that. Like, it's always embarrassing and scary.
No, that's horrible.
Yeah. So if they don't address it, things like that, incontinence could get worse. Patients that have pelvic organ prolapse, their prolapse could worsen or give them pain.
Oh my gosh. Okay.
Yeah. So just learning how to manage pressure, understanding their anatomy, understanding like what activities are safe at what time.
Yeah.
Yeah, because you don't want your prolapse to get worse, your diastasis to get worse. Like if patients have an ab separation and they notice like coning or doming.
When does that happen? Because does that happen for all women during pregnancy? Okay. Yeah. And at what point in the pregnancy does that happen? And can you explain to our audience like what that means?
Yeah. It will vary when it happens for women during pregnancy. It's going to happen to everyone because the rectus abdominis, that's like, you want to think about your six-pack abs. Right. They have to separate a little bit to make room for baby. Right. So I know.
Yeah.
it's
anything
kind of
muscles like pulling apart. That sounds
I know.
really painful.
Yeah. It can be sometimes like people don't even notice it. So, but it can happen at any point in pregnancy. It depends on, do you have one baby in there? Do you have two?
Oh, yeah.
How big does your belly get?
Yeah.
Is this your first pregnancy? Is it your fifth pregnancy? How strong were your abs before? It could also have to do with the position of your uterus. If you have a posterior leaning uterus, like your baby's going to sit more posterior, you might not have as bad of diastasis or separation. Okay. So to go back to your other question, diastasis recti is when the six-pack kind of separates a little bit. So those abs separate and you get a big space in the linea alba. The linea alba is a piece of fascia that runs north and south or up and down in between the abs. And we all have one. Yeah, and that linea alba space grows as the abs separate during pregnancy. Okay. So yeah, so afterward, after women have given birth, whether it's C-section or vaginal delivery, we want to make sure that we can safely get their abs back down, make sure that they have good tension in that linea alba.
Wow. So that linea alba is designed like by God, by our creator, to actually give a bit. It accommodates birth, childbearing.
Oh yeah. That's crazy. Yeah, also tied into like all the hormones during pregnancy, and like as we get more relaxin, that hormone that's running through our body that helps to give us more ligament laxity towards the end of pregnancy, that's going to help it stretch.
Okay, so the hormones and then the way it's designed, so all of it plays together, and women are so amazing.
Oh yeah.
What our bodies can do.
Yeah.
That's incredible.
Yeah, it's really cool.
So then you help them with strengthening that back up, make sure it's all functioning correctly, that you get your six pack. Don't worry, you get your six pack back. Your six pack abs back. And then also down there, so you're not sneezing in gym class and right, stuff like that is flipping happening.
Yeah. Okay. To make sure, those are like the big three, helping people manage their diastasis, like making sure their abs are coming, actually don't really need them to come back together. We just want really good tension in that elbow.
Okay.
Which is what more current research is showing.
Okay.
Yeah, but like making sure patients understand like how to safely activate their core, how to safely strengthen their core, what types of exercises they should and shouldn't be doing. Also, like making sure their prolapse doesn't get worse, which pelvic organ prolapse is when part of the vaginal wall will kind of like come down or start peeking out at us. Yeah. So
that sounds really painful too. Like, have you had people experience that? And what do they say when they come into you? Like, I'm in so much pain, or how do they experience or know that something's going on?
Usually with prolapse, they'll report kind of a sense of heaviness in their vagina, or sometimes pain, sometimes like rubbing. Or they'll say like, oh, I can see something doesn't look right, it doesn't feel right, or they'll have like pain with sex, things like that. So sometimes also when a patient comes in postpartum and they say, I can't fully empty my bladder anymore, or I'm having pain when I go to take a bowel movement, then we want to like check for prolapse also, because basically depending on where the prolapse is, part of the bladder could be kind of like falling into the vaginal wall or part of the rectum. So they might not be fully emptying their bowel or their bladder. So goodness. It gets crazy.
So you strengthen that, and then so explain to me, how would you correct that? And then so if somebody came in and they were like their colon was partially what did you say, like it was rubbing up against the colon and it was affecting them to the point where they couldn't completely extract everything that's in the colon, then how would you come in and help that? And then should they be able to then cleanse themselves like thoroughly?
Yeah, so with pelvic organ prolapse, there's a few things that we go over with patients. First, a pelvic floor therapist will assess for it and then grade it. So if you have, I won't go into too much detail about how we grade it, but if you have a stage 1 or 2 or grade 1 or 2 prolapse, then it can be treated with therapy. If you have a stage 3 or 4, then you need surgery. Yeah. So that's when we would refer you out. So you go to see a pelvic floor PT. We'll assess and see where you are. And then we talk about different positions to put you in to try to help that prolapse kind of go back to like where it should be, to unprolapse.
So like letting gravity kind of do its working with gravity. Have gravity work with you and not against.
Exactly. Yeah. So depending on like where their prolapse is or what, like what tissue is prolapsing. There are a few other types of prolapse that I haven't even talked about, but we'll put them in different positions and then go over some breathing exercises. Yeah, it's good stuff.
Nice.
There's like other exercises that patients can try. I might suggest that they get a pessary, which pessaries are devices that go into the vagina that give support to the vaginal walls.
Oh, okay. Okay, cool.
Yeah, almost like, sometimes we'll tell patients to like, put a tampon in there and see if that improves their symptoms.
A tampon sometimes helps, or in some cases helps.
Yeah,
wow.
It'll just give a little bit of support to the vaginal wall.
That's true. And it's like light too. It's nice and
okay. Oh yeah. Yeah.
Nice and soft support.
Yeah, there's a few things we can do. A lot of it is learning how to manage pressures, like intra-abdominal pressure, positioning, making sure that they are not constipated, because that can really play into worsening prolapse, and then walking them through some exercises.
If they are constipated, I know this just went off into a different direction.
It's okay.
Sorry, guys. Because it just made me think.
Floor PT.
Like when I was a kid, my parents would always tell me if I was constipated, they're like, eat your fruits. So does that come with some of your advice to them?
Oh yeah.
Is there a nutrition side to PT in the work you do?
There is. I'm not a registered dietitian or a nutritionist. so I can't give them like really formal advice on nutrition, but I kind of will guide patients and counsel them on like, when you go to the bathroom, whether you're peeing or pooping, you don't want to bear down and push,
Right.
because that can worsen your prolapse symptoms too.
Ooh.
So,
Have you heard, so I don't know where I heard this, but probably on TikTok. Everything I learned is on TikTok. But I heard that when you're on the toilet, this is actually kind of a good example here.
Yeah.
You should get a little stool and to put your feet
yeah.
should be around, and that's the easiest, most like ergonomic, I guess, way for the body to release.
Oh yeah. Yeah.
Do you suggest that to your patients with, okay.
Absolutely. Yes. Like, so we will, and going back to that nutrition question, like we'll counsel on like, are you constipated? What are some strategies that we can, do to not be constipated? I do have this little recipe that's sitting like somewhere on my desk about, this applesauce prune juice mix that, so
Prune juice,
yes,
yeah.
that will help you like pass your bowels easily. But yes, every pelvic floor PT loves squatty potties.
Squatty potty?
Have your
love
feet
that.
up. Yeah, because if you think about, let's go back in history, like people were squatting over holes to like have a bowel movement. They probably had great pelvic health. So, like, because they, weren't sitting way up on a toilet.
Yeah.
It just helps the pelvic floor relax. And that's what you want to happen, whether you're peeing or pooping. So,
yeah.
Oh my gosh. Yeah.
And I'm short. So like it's sometimes like my feet are like down. I'm like,
yes,
this is not.
No, that's not great.
It's
Always
not working out.
Yes. And if patients don't have a squatty potty, I tell them grab their children's stool or flip the trash can on the side. I don't care, but
anything would do. Yeah, just right there. Okay.
Yeah.
Perfect. Yeah, my dad told me when I told him what I saw on TikTok, and he was like, well, that makes sense. He said exactly what he's like, think about like cavemen. He's like, what were they? Yeah,
they would squat.
He's like, all of history.
Yes.
And I was like, that makes sense. And in other countries too, right? Some other countries
still do.
See, they got it figured out.
Like, yes.
What are we doing with these thrones?
I don't know. So I know. It reminds me of years ago, my husband went to South Korea and he visited a friend, and they had family members way out in the country, and they still had this outhouse, and you had to squat, and he was like, they're still squatting, and it's great. It's really appropriate for your pelvic floor to do that.
It is really good. Do you have any other advice for women? I guess this is a two-parted question. Any advice for women? Any advice for triathletes to help them in their journey now? So before it gets to the pain point, before they really need to come in and see you or beyond, before they're like, surgery to that point, do you have some advice on like some common things, like just add this to your daily routine, or just add that to your daily routine, and you'll see a huge difference with a small adjustment?
Yeah, I'm so talking about the squatty potty. Squatty potties are great. That's a huge one. If people can just like elevate their feet, especially when they're having a bowel movement, but sometimes also if you're having trouble fully emptying your bladder, that can help. Also, if people are having trouble fully emptying their bladder, I do get that complaint a lot. They should try to like kind of like do a little wiggle and dance on the toilet when they think they're done. Yeah, like moving your hips all around, forward, back, side to side circles. That can help you fully empty. Sometimes urine's getting trapped in like if you have prolapse in a part of the bladder that's prolapse, or just like in a strange part of the bladder.
That makes sense.
Man, I mean, I could give you tips all day about about things to do. So
just like one is good. Yeah. If they want the secret sauce, you want all the other tips, you have to contact Dr. Abby.
There you go. Thank you.
And then for the triathletes, would you recommend the same, or is there one tip in particular for?
Oh man, triathletes, I would say don't skimp on your strength training. I think what's hard when triathletes do long course training, which is training for a half Ironman or a full Ironman, they have so many hours. They're going to train like 10 to 20 hours a week. That's on top of usually people working full time.
Oh my gosh.
It's another part-time job. So it's hard to fit in some strength training and a little bit of just like almost like some PT exercises, but those things can go a really long way and really, really help prevent injury, especially in the run portion. So even for my short course triathletes that are doing like sprints and Olympic distance races, just having a little bit of strength work, if you can fit it in, it's really helpful.
Yeah, no doubt, especially on the knee area.
Oh yeah.
Importance of maintenance. So I know I just said, what should people be doing before they come in to see you? But do we want people to wait until they're feeling pain to reach out to you? Or do you prefer people come in for maintenance? And how frequent should maintenance be?
When I see patients on more of a maintenance schedule, it's usually like once a month. Maintenance is great. I typically have patients move to like a more maintenance schedule after they've seen me, for something before, but it doesn't mean that you can't come in just for maintenance. I have had people reach out and say, hey, can you screen me? I'm going to start training for XYZ race, or I'm going to go have a baby. So can you help prepare me? And there's plenty of things that we can go over, but and then, sometimes I'll screen people and I'm like, hey, you don't really need like therapy once a week right now, but if you, you can come in once a month. But did I answer your question fully? Or is it more like, why should people come in or when?
Well, that one too. Both actually, because when I think about PT and I think about people out there running that run with me, the only time I hear them mention PT is like when they've already had the injury. And I'm secretly thinking to myself, I wouldn't really call them out, but I'm thinking in my head, like, should have been done that.
Right.
You should have been seeing your PT beforehand.
Totally.
Maintenance. And then, I don't know. I think a part of me thinks that it may have prevented the injury, may not have, but either way, like you've already got this like flow of seeing this PT consistently.
Yes.
So what are your thoughts, like real talk?
Yes, got it. Yes, come see me, especially if you are new to running or you haven't run in years and you're going to pick it back up again, or if you want to train for a new race or something and you're about to really increase your volume. There are, I do like runner performance tests that I will run you through and to kind of like score you and say, okay, you're ready. Or, okay, you need to like increase your calf strength or increase your glute strength or work your ankles a little bit more because they look a little weak. So that kind of stuff can be very powerful.
Wow. Okay.
Yeah. And then also like, I get this question all the time, like, oh, I'm 3 months postpartum. I'm ready to start running. Can I run? And I'm like, okay, well, there's a lot of things that I want to look at. So all the run performance tests, I'm going to look at your mobility a little bit. I'm going to check your pelvic floor in multiple positions, like lying down, standing up, squatting, and checking for diastasis, like checking their abs. So there's a lot to do in the postpartum period when people are getting ready to run. I try to get people to come see me before 12 weeks postpartum because that is when we really don't recommend running prior to then.
Okay.
So
12 weeks.
Yeah, 12 weeks is kind of like the gold standard.
Okay.
That can change a little bit depending on if you had a major C-section or if you were running a lot during your pregnancy. It could be less than or more than 12 weeks before you should return to running. Okay. So there's a lot of things that we can do to prepare you to run.
So in between that 12, so they should probably just become seeing you even during pregnancy, like even before the pregnancy, they're like, hey, I'm planning on being pregnant. During the pregnancy, check up, make sure everything's okay. Let you know during the pregnancy, okay, I'm going to stop running at this date, and then I'll take it easy till the birth. And then even after the birth, okay, I'm in that 12-week phase. I want to start running eventually. You work with me, you let me know when you think I'm ready. Okay. That makes a lot more sense because, like I said, when I see people, they're like, wait till the last minute or wait till something's broke. I'm like, girl.
Now we're behind the 8 ball.
Right.
I know.
So thank you for saying that. I hope our audience is listening.
And even if you aren't pregnant or haven't been pregnant, like there's a lot of things that we can talk about when you are getting ready to run, like your shoes, what does your running look like? I watch people run all the time, you know. Are those the right running shoes for you? How old are your running shoes?
Yeah.
Do we need to change your running form? Maybe we don't, you know. Do we need to change your cadence a little bit? So yeah, running, you know, is so dynamic. There's a ton of moving parts, and so there's lots of things that we can do to set you up for success.
What does a running test look like? Because you said are there several running tests?
Yeah, there's like a lot of things that I want to see if people can do. Can they, how many single leg heel raises can you do? Can you do a single leg bridge and hold it, and for how long?
What's that?
Single leg bridge is when you're on your back and one leg is up and one foot is on the ground and you lift your hips up.
Not my favorite.
They're very challenging. Yes.
Okay.
And I'm looking to see if like people can stabilize their pelvis in that position. Okay. I'm going to look at a side plank with one leg up. Really hard.
Okay.
I know. I'm going to look at, I know. I'm going to look at an adductor plank, like their inner thigh strength. So having like, if I had someone put the inside of their knee on this box and then lift the ground leg up to see if those like your groin muscles can handle it.
That makes sense.
Yeah.
Okay.
Because all of these muscles need to work well if we're going to perform well. So.
Wow.
Yeah, so that's just some of them. I'm going to look at jumping. Like, can you jump from your ankles? Can you give me some quick taps? What does it look like when you stand on one leg? Can you step down laterally from a step? What are your hips doing?
Oh,
There's a lot going on up here when I'm watching people.
Gosh.
So, yeah, it's really fun.
That's crazy. That's a lot to think about.
Yeah.
But, I mean, I can see how every single one of those things makes up the sport of running or triathletes.
Yeah. Well, those tests, they'll just give me a good idea of where the person's at. And, you know, sometimes they don't have to like pass them all with flying colors to go run. But if I'm seeing like a lot of weakness in one area, then I'll say, okay, we really need to work on this before we do this, or we need to work on this before you go run 5 miles, you know, or let's start running and I'll have an idea of like what might start hurting. So,
wow.
Yeah, so we can kind of catch it.
So what are some exercises that you recommend to strengthen like the ankles or knees? I'm just thinking the camera is only to like there, so I don't know if you can, so let's go with knees, and maybe you can like lift a knee and show us.
One of my favorites is a loaded step up, which isn't, I mean, it's going to work a lot of things. So, but when I have people, so I'll have people hold 2 dumbbells or 2 kettlebells just by their side. One knee on a step, pull the opposite knee up and through.
Okay.
I'm looking to see, so that one's not like solely for the knee, but, for hips, glutes, quads, I'm looking to see like, can they stabilize their core? Can they stabilize their pelvis?
Yeah.
Can they hold it at the top and like squeeze their core, be balanced? It's working a lot of things. But that's one of my favorites.
Yeah, it's like triggering everything.
You got
think
it.
about it. And then, do they like? Are they supposed to shrug their shoulders? Because I guess. Like...
I don't usually want them to shrug their shoulders, but like if we wanted to work their traps, they
do a little extra at the top or something.
Yeah, totally. And yeah, it can't hurt.
And then for women, and so reverting back to pelvic health, for women who don't have babies and don't plan on having babies, can they still come see you?
Absolutely.
And okay, so I would fall into that category. So for women like myself, should we just come see you just because, like I said, maintenance, we should come in? Or is there something that we should be aware of that we can be on the lookout for? Like, oh, there's a sign. I remember Dr. Abby told me if I see that sign, give her a call. What would you say?
First of all, I think everyone should take a mirror and look at their anatomy down there to see, like, what does my vulva look like? What does my vaginal canal look like? Like, get to know yourself. So many women have no idea. And it's just good to know your body. So that's step one. And then, like I told you before, typically people come to me when they're in pain. But if you just want to have an exam and say, hey, can you check out my pelvic floor strength? Like, is it up to par? Do I need to strengthen it? Am I too tight down there? Do I need to stretch? Because lots of women have really tight pelvic floors, whether they've had children or not.
Oh.
So,
how would they know if their pelvic floor is too tight?
They come see me.
Okay. I was like, is there like,
I know.
it's not something you feel or.
So if you have like sometimes pain with sex, your pelvic floor may be too tight.
Okay.
That there could be a million reasons that, intercourse is painful, but that could be one of them. When people cannot have penetrative sex, like they probably have a muscle issue that is also like highly tied into, brain body connection and breathing. So that's a whole nother podcast episode that we could talk about. But
wait, can you let's go there. Brain, because my eyes lit up and my ears were like ding, like when you said brain.
Puppy dog ears. Yeah.
Brain. Yeah. And what was it? Breathing.
Brain body connection.
Brain body connection. Mm-hmm. And you said breath exercises.
Yeah.
If you want to go there, let's go there. I love it because this podcast is all about an umbrella over east to west modalities and everything in between.
Yeah.
And so when you talk about brain and body and breath, those words are like SEO optimized.
Yeah. Oh my gosh. I love it. Yeah. So women hold tension in their pelvic floor, like just like right here in their jaw.
Yeah.
And right here in their upper traps.
Oh, girl. I know it. I know it.
So yeah, if you're really tense here, there's a high likelihood that you are really tense in your pelvic floor too. Oh my God. Which is pretty wild. I know. And a lot of women just don't know it. So,
wow. And that's what chiropractors say too. It's like this, well, not about the pelvic floor for women, but like that people hold a lot of tension here.
Oh yeah. And
start experience that TMJ.
Oh yeah. Big time. I can treat TMJ too. Like and I used to do a lot of it because so much like we live in this society where we're just like, I don't know. I feel like I was thinking about this earlier, society has just set us up, especially women, to be like really anxious. So
yeah,
it's bad. And so many people hold tension here and in their pelvic floor.
Yeah.
When people have an extremely tight pelvic floor, to the point of where they cannot have like anything penetrating their vagina, they might also have a history of trauma. There's a lot there. And, whether it's trauma that they have like talked to someone, a mental health therapist about or not, there's a lot going on there. But yeah, there are women out there that cannot even like use tampons because they are, so tight down there. So.
Yeah.
I know it's tough. So this is why there's kind of been a movement in the past few years that, people are saying like, don't Kegel anymore. A Kegel is a pelvic floor contraction.
Right.
And it's because they were finding that so many women had overtight, overactive pelvic floors that they were like, you need to do the opposite and down train.
I hadn't thought about that, but yeah, you're right. I've always heard like do your Kegel exercises. So that's not a trend anymore. That's not.
No.
It's out.
It's out.
Out with the old and with the new.
That's right. The new is go see a pelvic floor therapist and they will guide you.
Okay.
In what you need to do. So,
wow. Okay.
I know.
Good to know. Ladies, stop with the Kegel exercise.
Yes. Stop Kegling right now.
Please. So it sounds also like your industry ties in or could tie in with people that help with tension and stress as well, like a talk therapist.
Absolutely.
Like a breath worker, maybe. Yoga, meditation.
Yes.
Oh my gosh.
Yes.
Yeah, all of those things. So if maybe they were to do some like yoga classes and breath work and then come see you too in conjunction with that, do you have anyone that does that you know of? And have you seen results? Have you seen the proof in the pudding?
A lot of my patients do yoga.
Nice.
Yeah. And a lot of if patients have a tight pelvic floor, a lot of the moves that I'm going to give them are yoga positions.
Oh, cool.
So help relax the pelvic floor. So,
oh, wow.
Yeah. Like happy baby, or we do some cat-cow and then child's pose, or like sitting in a deep squatted position, like a supported squat.
Oh, neat.
Yeah, which I can't think of what that yoga pose is, where you push your elbows into your knees.
I'm not sure, but I know which one you're talking about.
You know what I'm talking about? Yeah.
It's really good.
Yeah.
It's really
that one.
I just do that when working out. It's such a good stretch.
Yes.
And then people in those videos that are to strengthen your knees, they always say to do and get low.
Yeah.
So I'm
great.
Just try to keep that mobility.
Yeah, totally.
Down there.
Yep. Yeah.
Having two pit bulls and having to like
get,
run after them and pick
get
them
down.
up. And
yeah, and it's also keeping your mobility down there in the pelvic floor.
So good to know. And nice to see how you can incorporate your business with other local Nashville practitioners.
Absolutely. If you're a breath worker, call me. Yes. We need you.
I got someone for you.
Okay, great.
I'll give you her info.
Yeah, that'd be great. But yes, yoga. I mean, I try to counsel all of my patients to see a talk therapist because I think that talk therapy is extremely powerful. I can't remember if there's one. I have a few talk therapists that I will kind of refer to.
I love that. Yeah, because that tension, I'm sure, gets stored throughout several parts of the body. Who even knows how much it can affect?
Pelvic health land is vast, and so is like orthopedics and chronic pain in the PT world. But I will say there are a few things that I want people to know in regards to pelvic health, and then also in regards to like sexual health. I would say I always encourage patients to use lubricant when they have sex. I grew up in the South, and I feel like it is kind of stigmatized and people don't talk about it, and people don't like to use lube. And I'm like, please use all the lube. It's just, you'll thank me later. So
what do you recommend? You want to give a brand shout out?
I like Good Clean Love. They're a water-based lubricant. Yes. Especially for women that are breastfeeding and in the early postpartum phases, I try to counsel them all to use lube because when you're breastfeeding, your estrogen levels are still really low. So you're going to have vaginal dryness. And sex can be very uncomfortable. So I'm always like, on my egg crate screaming like, use more lube. So it'll just be better. So that's one thing, and I think if women are listening and they're having like pain with intercourse, or if they're having a lot of pain postpartum, to come see me. Like I had a friend call me and she said, I have pain when I'm like sitting on the toilet and like I can barely sit up straight. And she had just had a baby and I was like, oh, okay, well something's going on down there. Just to like understand your body and what's happening and how can you manage that pain. What can we do about it? You don't have to just like suffer through it. And then for my runners, I'd say my runners and triathletes, if you have like something that feels like a tiny nagging pain, don't ignore it. Come get it checked out. It will probably develop into something else. So let's catch it early, see if we can make some easy changes. And and then we can prevent, you having to stop running. I try to keep my patients running as long as possible. Like if they come see me, I'm not always like, oh, we have to shut down running. I'm like, hey, let's try XYZ and you can continue to run unless we really need to. If I'm like, okay, no, we have to stop running for a couple of weeks and then we'll try to, re-enter. But I think that's a big fear that people have. They're like, I don't want to go to PT because she's going to tell me to stop running. And I'm like, well, probably not. So,
an advocate for running here.
Yes,
so
big time.
She's got your back. Well, and your rear and and your rear and all of the things.
And your pelvis.
And your pelvis.
All the things. Yes.
No, that's great advice because you're right. I could see how somebody would be like, no, because then it's going to put a damper on my running. But no, she won't.
No, definitely not. Oh, also one other thing. I see patients running incorrectly with a stroller all the time. Would love to help you run with a stroller the proper way.
Okay.
And the safe way.
What are they doing incorrectly?
Oh man, a biggie is you have to lock the front wheel. So there is a lock on it for a reason. And that is a huge safety thing. Like if you're going to run with a stroller, you've got to lock your front wheel. And then it makes it hard to turn, but you have to pop a little wheelie when you turn. And that's just like, if that front wheel is wiggling around. So running strollers are usually like tripods or three-wheeled.
Oh, three-wheel. Okay.
Mm-hmm. One in the front and then two in the back. But if patients are running, and especially like at a pretty fast pace and up or down a hill, that front wheel is going to wiggle a lot, and you don't want the stroller to tip over. So,
oh
yeah.
my gosh.
Yeah. So I'm always like, lock your wheel.
Yeah. I wish I would put like a warning sign on the stroller too.
I think they do, but a lot of people still just don't do it. I don't know.
Like,
I'm like,
don't read the instructions.
Right. I'm like, lock your wheel.
Okay.
Yeah. And then, baby has to be old enough. They usually have to be about 6 months old to be in the running stroller.
Okay.
If you're going to run with it.
Okay.
They have to have good head control. So sometimes it's a little earlier than 6 months. You should always check with your pediatrician if you're going to start running with a running stroller to make sure that they are okay and your baby is ready.
Yeah.
And then come see me so I can make sure that you are ready.
You're okay and you're ready. Yeah.
Yeah.
And I just want to go back to, you mentioned the lube.
Yeah.
And water-based.
Yes.
Can you elaborate a little bit more on why water-based?
Yeah. So water-based and silicone-based lubes are both fine. Or they also make a combo. That have water and silicone. Okay. Water-based is just generally easier. People have, like, if you are sensitive to products, then I would definitely try a water-based lube first. Some things to know about water-based lube though are, if water-based lube is touching the air more often, it will dry out faster. So you might have to reapply.
Okay.
Silicone won't do that as much. Okay. And then just another safety note, you don't want to use a silicone lube with a silicone condom or sex toy or anything, because silicone and silicone will break each other down. That's going back to chemistry class right there. So
that's a ruptured condom.
Yeah.
Woo!
Yeah. And I don't know, I haven't seen a silicone condom. I don't know either, but if they do, don't use your silicone lube, because it won't work. They break each other down.
Oh, wow.
Yeah.
So if they have silicone toys and they're using silicone lube, what could that do to a woman's vaginal canal?
I don't want to know. Don't do it, because they will break each other down. Yeah. So let's avoid it.
Stay with the water-based.
Yes.
It's more natural.
Yes.
More organic. More for people with skin sensitivity.
Water-based.
Right? Yeah.
Yes. Yeah. Yes. I'm like always handing out samples of lube, good clean love, slippery stuff, both water-based lubes.
Okay.
I just got another kind called Kindra. I haven't tried it yet. I haven't passed it out yet, so I don't know. Uber lube with the UBER with an umlaut on top is supposed to be good. That one is not water-based, but yeah, I'm kind of letting people try different kinds. Another perk of public health PT is to get lots of lube samples. So I'm like always giving them to all my friends and everyone.
When it comes to the world of physical therapy, just in general, if somebody listening right now, maybe they don't have time to listen to this whole podcast and they're like, I'm going to fast forward, go to the end, and I'm going to get like the nugget of information that they have for us at the end. Is there any kind of resource, like a book or a blog or a website, that you can recommend to the audience? Hey, if you want to know more about PT, read this.
Yes, there's like tons of great Instagram accounts out there in regards to like pelvic floor PT. I mean, there's like plenty of great running PTs out there too that are producing excellent content. But top of mind is Pelvic Floor University is a good one. That's obviously pelvic health related. And then the Vagina Whisperer has a great account, all things pelvic health. She's also in New Orleans, so fun to see New Orleans, where I grew up. And then there is a book that I haven't read yet, but it's on my reading list. It's called It's Not Hysteria by Dr. Karen Tang. It's all things reproductive health, sexual health, pelvic floor related. It's supposed to be very good, pretty new book. It sounds really great. I have read some reviews and it looks amazing. And other pelvic floor therapists have read it and they loved it. So that's what I'm reading next. But yeah, there's some really good accounts there to follow.
Okay.
So, yeah.
And your account.
And mine.
What's your social media handle and where can people find you online?
Yes. PeakTempoPT.com, at PeakTempoPT. at peak_tempo_PT is my Instagram handle. I'm also on Facebook. And then, all of my contact information is on my website. If you have questions, shoot me an email or call me. I do clinic visits and home visits.
Oh, home visits too.
Yeah.
Okay. Thank you so much for being on the show.
Thanks for having me.
Thank you for tuning in to today's episode of the Nashville Wellness Collective podcast. Like, share, and follow us on social media at the Nashville Wellness Collective for exclusive content and giveaways. Thank you again to Dr. Abby Daunis. To contact her or to learn more, please view our show notes. We'll have all the details there. If you'd like to be a guest on the show, please visit us online at TheNashvilleWellnessCollective.com. Follow so you don't miss an episode. Until next time, the Nashville Wellness Collective has you covered from east to west.